All righty. This is SB 351. It would allow the Board of Medicine and the Board of Nursing joint license, dealing with the Board of Nursing joint license and advanced practice of registered nurses. This is a proposal that embodies common sense and aligns Virginia with the broader national trend in healthcare regulations. This bill is about simplifying and streamlining the licensing process for our advanced practice registered nurses by removing redundant professional regulation. At present, Virginia is one of the only 3 states that requires an additional layer of regulatory approval for APRN licenses through the joint boards of nursing and medicine. This is not only an anomaly, but an unnecessary complication in our regulatory framework. Senate Bill 351 proposes a sensible adjustment to bring us in line with the majority of the United States. It is important to clarify what the bill does and what it does not do. This is not about diminishing standards or oversight. Instead, it is about administrative efficiency and consistency. The Board of Nursing, which already plays a significant role in licensing APRNs, is well equipped to handle the responsibility independently. This bill is about meeting our workforce needs. At this time, 40% of the graduates from our nursing programs in Virginia leave the state for jobs with less restrictive regulations. I know there are a lot of people who are here in the room who have a variety of opinions on this. I know it is controversial. We have had extensive discussions with the regulatory professions who are dealing with this, as well as the doctors. And I would ask if anybody is here in support of the bill to come forward. And we're going to try not to spend 3 hours on this if we could, try to keep our comments timely. Let's keep our comments to 5 minutes per side. 5 minutes total per side. Yes, and if you would hit the button, introduce yourself and tell us so we can hear you. Yep. Introduce yourself and tell us who you are. The green button should, there you go. You did it.
Scott Riggleman with Americans for Prosperity. We support the bill because it does streamline the licensing process, and appreciate you carrying it.
Thank you.
Hi there. I'm Ashley Apple, Virginia Nurses Association. I'm a nurse practitioner and professor of nursing. 50 years of empirical data that proves the quality and safety of advanced nursing practice. 27 states and DC have full practice authority, which by definition means they're regulated solely under the Board of Nursing and they allow independent practice. There's no evidence that a joint board provides any benefit to the public. In fact, it may cause harm. The Federal Trade Commission warns that when states allow regulatory oversight by physicians, quote, they effectively give one group of healthcare professionals the ability to restrict access to the market by another competing group. And to be clear, in this case, the market is healthcare. The FTC calls this practice anti-competitive, citing the risk of physician bias due to professional and financial self-interest. These competitive costs should not be imposed on the public without compelling evidence of benefit to health, safety, or consumer protections, and there is no such evidence. We ask you to help us fix this. And here's the Federal Trade Commission report for you. Appreciate it.
3 minutes and 48 seconds.
Good morning. My name is Nicole Wardlaw. I'm a certified nurse midwife. I live and work in the Hampton Roads area. I have a practice, and I'm also one of the midwives that started a midwifery practice in Hampton, which is a medically underserved area. My concern, and I support SB 351, my concern is always the address of the lack of maternal care clinicians. We are in maternal care desert in our area. Streamlining the midwifery regulation through the Advisory Committee of APMs, which is Advanced Practice Midwives, to the Board of Nursing, is an important step to modernizing the Virginia midwifery workforce, which has yet to achieve the World Health Organization's recommendation of a minimum of 6 midwives per 1,000 births. When there are delays in the licensure, the health of Virginians overall suffers. I personally worked on the 2021 Certified Midwife Bill because the care of practice by midwives is one key proven way of improving maternal and perinatal mortality. Right now, as of February 2024, we still do not have certified midwives licensed in our state, only because of that just regulatory bodies and the red tape. So I would ask that you support SB 351.
2 minutes and 23 seconds.
Hi there, I'm Alicia Pack. I am the Virginia Council of Nurse Practitioners President-elect. Just a couple of poignant comments. I ask that the hypocrisy of the opposition to this bill is not lost on you. While on one hand they point out that NPs are not physicians in any way, shape, or form, and we agree, we are not, they remain adamant about having NPs regulated by physicians, an entirely different profession. The most important part of the role of nurse practitioners is nurse. The Board of Nursing, with the requisite expertise in nurse education, training, and practice, is the entity best suited to regulate NPs, which is the standard in 46 states and DC. Unnecessary restrictions of APRNs negatively impact patient choice, access, economic growth, entrepreneurship, and the regulatory cost of health care. This is a common sense and cost-efficient step. We ask that you support Senate Bill 351.
1 minute and 25 seconds.
1 minute and 25 seconds.
Good morning. Good morning, members of the committee and chairman. My name is Karen Kelly. I'm a certified midwife, and I'm the president of the Virginia affiliate of the American College of Nurse Midwives. I would like you to pass this bill because Virginians deserve confidence in a well-functioning regulatory process that isn't weighed down by unnecessary red tape. Advanced practice nursing and advanced practice midwifery are unique professions made up of individuals who've completed at minimum a graduate level education, adhere to specialized training and standards of care by their individual professional organizations, and practice distinct disciplines that may have similarities to medicine but are their own unique specialty. Even ACOG, who is the profession that midwives most frequent, represents the physicians that we're most likely to work alongside, support that midwifery is a distinct individual profession separate from medicine. 3 studies so far have been submitted by the Department of Health since 2021 supporting this change, and in review of other health profession boards in Virginia, they are uniformly composed by professions they represent. The Board of Psychiatry is made up of psychiatrists, the Board of Pharmacology is made up of pharmacologists, the Board of Optometry is made up of, you guessed it, optometrists. While you could argue that their roles share overlapping areas of practice with physicians, they do not have medical doctors on their regulatory boards. Passing 351 is a necessary initiative to show that Virginians are in good support. Thank you.
Thank you very much. If you just quickly express your feelings.
Yes, ma'am. My name is Josh Carlson. I'm a nurse practitioner, and I come to you as a vet. So I served in the United States Navy.
That's all if you just say yes, that's all I wanted to hear. Thanks from you.
Virginia, we support the bill.
Thanks. Is there anyone from the administration?
Aaron Barrett, on behalf of the Department of Health Professions, we support the bill.
Thank you very much. I appreciate it. How about the people who are in opposition? We'll have 5 minutes for that.
Madam Chairman, Scott Johnson, General Counsel for the Medical Society. Let me first say, this is not about doctors hating nurse practitioners or midwives. We need each other. We work together. It's a difference of opinion over training and what is established. Thank you, too, for your time. You've been very gracious in meeting with us and all of that. We have had the Joint Boards of Medicine and Nursing for a long time, and the boards work. There are some wives' tales out there about the boards don't meet and don't do any discipline. So, Madam Chair, if you would hand out to your fellow members there, you see since 2018, the boards have met 73 times. There is one set of regulations that govern the practice for midwives that is in place, but the large part of what the boards do is do discipline, and that's what you want. You want clinical experts in the room doing that. The other thing you need to be mindful of is this is a sequence issue. If the joint boards are eliminated as is proposed in this legislation, the next step is going to be a nurse APRN joining the compact. And once you join the compact, the language on page 6 of the compact itself says that nurse practitioners can practice without supervision or involvement of physicians. I'm going to cede my time to the other expert witness we've got here, but I ask you to gently lay this bill on the table. Thank you.
Thank you.
3 minutes and 40 seconds.
Good morning, Madam Chair. My name is Kathy Scarbalis. I'm a PA, a physician assistant, with over 40 years of practice experience, and 20 of those years being here in Virginia. The other 20 were worldwide. My husband was in the Army. I stand in opposition to this legislation, which would dissolve the joint boards of nursing and medicine and consequently establish two separate and distinct paths of oversight and discipline for licensees practicing medicine in the Commonwealth. To be clear, NPs, PAs, and physicians all practice medicine, meaning that we all diagnose, treat, and prescribe. I am the immediate past chair of the Physician Assistant Advisory Board to the Board of Medicine. In this role, I chaired disciplinary cases for PAs. Members of those boards were PAs and physicians. NPs should have the same. They practice medicine, and others practicing medicine should hear the case. If the joint boards were dissolved, NPs would be regulated and have disciplinary cases overseen only by the Board of Nursing. The Board of Nursing is only required to have 2 advanced practice registered nurses within its membership, and is by design made up of a majority of members who are registered nurses and licensed practical nurses. The valued RNs and LPNs do not have training in medicine, and to practice medicine and adjudicate a case of misconduct for an APRN that is practicing medicine would not create fair outcome. This disparate outcome for patients and providers is not fair to patients or providers when it comes to patient protection. I ask that you maintain the joint boards and ensure that all practitioners in Virginia who practice medicine are treated at the same standard. Thank you.
Thank you very much. I appreciate your testimony today. This has been something that we've been talking about for years, and I know that there are very passionate opinions about it. This committee works by motion. I will move that we report the bill. Is there a second? Okay. Hearing none, it appears that the bill will not be reporting. Fails to report. Do we need a vote, or there's no vote?
Madam
How
Chair,
do we handle
there's
that?
no motion on
There's
the
no
bill, so
motion.
that it does not fail to report. It is simply still within the body of the committee.
Okay. Thank you very much. Appreciate everybody. And Senator Suderline has just arrived.